Top stories from around the island. To the point. Without the fluff. Puerto Rico headline news. Please subscribe and don't forget to hit the bell notification.
Hello and welcome to Puerto Rico Headline News for March 31st, 2020. If you haven't yet done so, please subscribe to this channel, like this video, and don't be afraid to share this content. So let's go ahead and go into the COVID-19 update for today for Puerto Rico. And I'll also cover some additional information that I mentioned in my previous video about the scandal that's happening in the Department of Health. So here we see the headline from El Nuevo Dia for Tuesday, March 31st, that they've added 2 additional deaths because of the coronavirus, 2 of them being women. So let's go ahead and go get into this article. And it says, the health department confirmed Tuesday that the death toll from the COVID-19 coronavirus in Puerto Rico increased to 8 after 2 additional deaths were reported. Meanwhile, confirmed cases have increased to 239, which represents 65 more than those reported yesterday. So in total, the breakdown, it's 132 are men and 107 are women. And here we see this graph that is being released on a daily basis by the Department of Health, and just gives us a clearer picture of the trend of confirmed cases that are occurring here. So we can see here as of March 13th, when they started reporting confirmed cases, and where we're at now at 239 confirmed cases. And we see that uptrend at that angle there. So now we'll continue on with this article. The agency detailed that the most recent deaths were that of 2 women who had no travel history, again confirming the community spread that is now occurring in Puerto Rico. So the first of these cases was a 50-year-old Bayamon resident who was diagnosed with the coronavirus while being confined to an unidentified hospital. The second death that occurred is that of another woman who is or was 66 years old and was admitted to a health institution in the Caguas region after showing symptoms of having the coronavirus, and subsequently she was tested as positive. Now these 2 cases are added to the already deaths of a 60-year-old man who traveled to New York, the death of 2 men, 68 and 42, to that of a 48-year-old Puerto Rican, followed by the 73-year-old tourist from New York, and way back at the beginning, an Italian tourist who was 68 years old. Here's another graph that gives us an idea on the amount of case testing that's been taking place. So if you see here this orange yellow looking line, these are pending results, test results that are pending, and we're waiting for the test results. The red are the confirmed positive cases, and there's supposed to be a light blue of those that have recovered. As of yet, it's only been 2, and the deaths is down there as well. But this gives us an idea of the amount of testing that's being done, and unfortunately the amount of tests that we are still waiting to receive results on, which is seems to be a big deal there. So we'll continue on with this article, and it mentions here the increase in deaths from the coronavirus, as well as the increase in positive results on the island, are indicative that it is time to redouble our efforts, or double our efforts, focus our energies on fighting the virus and stopping its spread on the island. We will not skimp on obtaining the necessary resources to facilitate that our people and the health system are as prepared as possible to face it. However, it is in the hands of the public that its impact remain minimal and that it slows down the contagion curve. And this was said by the health secretary, the new health secretary, Lorenzo Gonzalez, in a press release. Now, according to this official, 10 of the new 65 cases, confirmed cases today, were processed in the Department of Health laboratory. 5 were confirmed in the Veterans Hospital, and 50 were confirmed in private labs around the island. So they're certainly contributing to the fact of the amount of tests and results that are coming in compared to a few weeks ago. Now here we see an additional graph or map that helps us to see where these clusters of confirmed cases are appearing. And we can see there in the darker shade of red, this is the San Juan metropolitan area where there seems to be a higher concentration of those that are affected with the coronavirus. Although compared to a few days ago and even the map from yesterday, we see that it is slowly spreading, or it had already spread, but now since testing has increased, a lot more confirmed cases are appearing even way down south and further west on the island. So that's concerning as well. So continuing on, the article mentions that San Juan is the municipality that has the most cases with 23, followed by Guaynabo with 14, Bayamon with 11, and Caguas with 10. So if you live in those areas, be super alert and safe as well. Now, towns like Coamo, Vega Alta, and Yauco are part of those who reported new cases. These are new towns with new cases that have been reported. However, the government does not have available information on 130 confirmed cases. So they're limited as far as information, where they're from. So they don't have that information. Now, Gonzalez Feliciano also detailed that the coronavirus tests carried out in Puerto Rico increased to 2,289, of which 1,195 have come back negative, and 854 tests are still pending as far as receiving the results. For his part, the director of the COVID-19 Medical Task Force, Dr. Segundo Rodriguez, maintained that we need to control the spreading of this invisible enemy. And as you're well aware, in order to do that, they extended the lockdown measures in place to go through the April 12th, along with some additional restrictions. And I have a video on that as well. I brought out in my previous video about the scandal that's occurring in the Department of Health. And here we can see in the El Vocero online newspaper the information that's coming out. This is the new Secretary of the Department of Health, Lorenzo Gonzalez. So he's already begun an investigation into the accusations that the previous Secretary of the Department of Health, as she was leaving her position or resigned, the accusations that she made. So this article gives us a little bit more information. I'm going to basically cover what he's doing here. So the Secretary of the Department of Health, Lorenzo Gonzalez, ordered that 100% of the contracts maintained by the placement firm Manpower with the agency be verified in terms of the employees that have been hired and the salary that has been awarded to them, to make sure the pay is consistent with the tasks they perform. Now he's doing this because some accusations came out on some hefty salaries that were being paid to many unqualified people within the department. The information continues to say that this information was made public yesterday after the dismissal of Mabel Cabeza, or the chief of staff under the command of the then Secretary of Health, Rafael Rodriguez Mercado, amid complaints about the hiring of family and friends and the irregular handling of evidence of coronavirus. So he went ahead and just fired her, Mabel Cabeza. It also mentions here Cabeza was identified by the interim ex-secretary of health, Concepcion Quiñones de Longo, as the person who was given, without her knowledge, 550 test kits for molecular tests of COVID-19. The delivery was made on the third floor of the government's Emergency Operations Center building, a management that Quiñones de Longo had also not authorized. So for a time, there was these 500 test kits that had gone missing. When Quiñones, the then Secretary of the Department of Health, was asked about them, she had no clue. And apparently, Mabel Cabeza had made the decision to undermine Concepcion Quiñones and have these tests delivered somewhere else, unbeknownst to Concepcion Quiñones. And so those were delivered to the Emergency Operations Center, and apparently they've been found. It's not clear, but they were delivered there. Now it says here that yesterday, early in the day and prior to the dismissal of Cabeza, La Fortaleza ordered the health secretary to initiate an investigation into the allegations of Quiñones de Longo, to which new revelations were added in press reports. Now notice this information here. El Vocero, let me scroll down so you can see where this information is coming from. Right in this section right here, I'll translate it. It says, El Vocero published yesterday that Lumari Cabeza Rivera, Mabel's sister, the one that was fired, had been hired in the office of the Health Medicaid program through Manpower with a pay of $30,559.33 for a period from January 30th to February 29th of this year. What is that? About a month of work. She was paid over $30,000, corresponding to 561.55 hours. And this newspaper, or the Medium, this reporter reviewed a copy of an invoice with this information. So El Vocero has paperwork, proof of this payment made to the sister of Mabel Cabeza, who was fired because of nepotism, corruption, mismanagement of supplies. So the investigation has already begun. It's ongoing, and so more information will come forward, I'm sure, in the next few weeks. But that's just an update on what's going on there. In regards to this scandal that's taken place in the Department of Health. So that's your update for today regarding the coronavirus here in Puerto Rico. So thanks again for watching. If you haven't subscribed, please do so, like this video, and don't be afraid to share this content. Thanks again for watching. This is Puerto Rico Headline News.